Well, it's been almost a year since experts first identified a mysterious COVID-linked illness in children, and now researchers have released pictures of one key symptom.
Nightteam's Hensel has this special assignment report tonight, spotting the signs.
It's called multi-system inflammatory syndrome in children, or MIS-C. The illness can appear weeks after a child gets COVID.
It seems to be a very rare syndrome, but we need more information.
Experts are learning more. The CDC says there have been 2,060 reported MIS-C cases in the U.S. 30 children have died. Doctors are now providing picture proof of one of the syndrome's most common symptoms, rashes.
In terms of a journal article, that's the first time I had seen it summarized in that manner.
These pictures are from researchers at Children's Hospital of Philadelphia. The team studied 7 MIS-C patients and discovered all of them developed a rash on their lower body, and 5 out of 7 had a rash on their inner thighs. Some had rashes on their arms, legs, and dime-sized circle lesions on their backs and chests. Dr. Marcos Mestre is the chief medical officer at Nicholas Children's Hospital.
Typically, they're going to be these kind of red, flat type rashes that just kind of don't have a clear shape around it. It just kind of spreads out throughout the body.
While there was not one defining rash, researchers hope their work will help other doctors diagnose future cases. And for parents, rashes are just one sign of possible trouble.
The symptoms we always tell parents to watch for are fevers, sometimes abdominal pain, some redness of the lips, redness of the eyes.
At that point, nobody had really heard of MIS-C.
Correct.
It was last April when Melanie Somnet's son Ezra got sick. The St. Augustine mother says her 6-year-old had a fever, bloodshot eyes, and was throwing up.
Both cheeks were very flushed. He had the rash on his neck. He had a rash on his torso and on both of his arms.
Despite MIS-C, Melanie says Ezra is doing well today.
Over the last month and a half, we have seen them pick up a little bit more, not quite as what it was in the summertime.
Just how many MIS-C cases have been diagnosed here in South Florida since the beginning of the pandemic? Nicholas Children's Hospital says they have seen between 50 and 60 patients. At Jackson's Holtz Children's Hospital, they have treated 9 children. Up in Broward, Joe DiMaggio Children's Hospital has treated 60 patients, with another 20 at Broward Health's Sala Foundation Children's Hospital.
Just to also ease the mind of families and parents, this is a very rare condition with COVID infection. But at the same time, we always want to make sure families are aware of it.
These heartbroken parents in Tennessee also want families to be aware.
She was everyone's favorite. She was the light of my life.
Priscilla and David Morris's daughter Gigi is one of COVID's youngest victims. The 6-year-old died last summer.
She did have a rash on her shoulder, which we found out later is a child sign of COVID. We didn't know. So any parents who have kids who are lethargic, throwing up, and have a rash, they need to go. That's the last photo that I took of her.
Gigi's case is a reminder that although adults are most at risk from COVID, spotting the signs early on children is key. Karen Hensel, 7 News.